In our earlier videos, we have discussed how genetic testing can be used to find changes in genes that cause health problems. But you might be wondering about how to access genetic testing. Although there are many private companies offering genetic testing, these are not usually meant for clinical or diagnostic purposes. To access NHS diagnostic genetic testing, you will need to make an appointment with your family doctor or GP, which stands for General Practitioner. If you are not registered, you must first register with the practice. By following NHS guidelines, a GP can assess if you need to be referred to NHS genetic services. If you are under the care of an NHS consultant, hospital specialist, or community paediatrician, then these clinicians can sometimes also order genetic tests or make referrals to an NHS genetic clinic. Your GP or clinician may ask you about your symptoms and may ask you if you have a family history of genetic conditions. A hospital specialist or clinician might refer a person to an NHS genetic clinic or order a genetic test for them if they suspect that the person has a genetic condition or that they might pass a genetic condition onto their child. A person may also be referred to a genetic clinic if they have several family members with a known genetic condition or a strong family history of cancer. If a person is concerned because there has been a confirmed genomic diagnosis in the wider extended family, then they may also request their GP or clinician refer them to a genetic clinic for assessment. Where a person has already been diagnosed with a genetic condition, they may wish to seek further advice from clinical genetic services, or they may wish to find out whether other members of their family may be at risk. If a person has learning difficulties or developmental delay, which their doctor thinks is due to a genetic condition, then they may also be referred. Finally, if a person is pregnant, they will be offered screening tests for inherited conditions. If they have received an unexpected test result from prenatal screening, their prenatal screening team may refer them to clinical genetics services. You may have been referred by your GP or other clinician to clinical genetics services for them to carry out genetic testing. If you have already undergone genetic testing via your hospital consultant, then they may be referring you to genetic services for a more in-depth discussion of your results. Prior to receiving a clinic appointment letter, you may be asked to complete a questionnaire so genetic services can learn more about you and your family history. Appointments normally last between 30 and 60 minutes, and you may bring family members with you. If you need a translator, you may either bring one with you or ask for one to be arranged. There are a number of different healthcare professionals who you might see at your appointment. A clinical geneticist is a medical doctor who specialises in genetics. They can order tests and make a diagnosis. They may help to coordinate your medical care with assistance from other hospital health professionals. A genetic counsellor, sometimes known as a genomic counsellor, is a healthcare professional who can explain genetic conditions and help you understand the benefits and disadvantages of genetic testing. Genetic counsellors can also order tests and explain test results. Although genetic counsellors cannot provide you with a diagnosis, they can support you through a diagnosis. They can offer support and guidance with the decision-making process, both before and after genetic testing takes place. Genomic nurses and genomics associates and practitioners support genetic counsellors and clinical geneticists with the consent process for specific genomic tests, the collection of patient information, test samples, and test results. In some specialities, the genomic nurse can also order tests. During the appointment, the genetic counsellor or clinical geneticist might draw a family tree with the information you give them. If you haven't already undergone genetic testing, then they might also discuss the option of genetic testing with you. If you consent to genetic testing, you will also have the option of having the test at a later date. This will give you time to consider if having the test is the right decision for you. Genetic tests done on the NHS are free of cost. A genetic test is usually carried out by taking a small sample of blood or saliva which is sent to a special laboratory where the DNA is analysed. There are many different types of genetic testing, so the right type of test for each person will be different. Genomic testing is a complex process, so depending on the test and condition, some results may take several months to come back. The healthcare professional who ordered your test can tell you how long it might take for the results to be returned. Waiting for the test results should not delay any treatment that has already been planned. But the test results may help to determine whether any changes to the current treatment plans are required. If your test was ordered by Clinical Genetics Services, then you will have a follow-up appointment with them to receive your results. If it was a hospital specialist or clinician outside of Clinical Genetics Services who ordered the test, then they will give you the results of the genetic test. They may decide to refer you to Clinical Genetics Services so that you may have a more in-depth discussion about the results. You may also be offered genetic counselling. If a diagnosis can be made, then during your appointment, you will be given the latest information about the condition and how to manage it. A clinical geneticist will use the test results to help decide which medicines to use, devise a treatment plan, and determine if any clinical trials are available to you. It may be helpful to discuss your results with a genetic counsellor who can help you understand what the results mean for you and your family. As well as diagnosing rare or inherited health conditions, genetic testing can also reveal if a person is at higher risk of developing certain genetic health conditions, including certain cancers such as breast cancer. In this instance, a genetic counsellor or clinical geneticist can help a person determine what options may be open to them. A genetic counsellor or clinical geneticist can also provide advice to a family about how a diagnosed condition might affect other family members. They do this by calculating the probability of a family member inheriting a condition or of being a carrier for a condition they can pass on to their children. Sometimes carrier tests may be carried out on a healthy individual to determine if they are a carrier of a genetic condition. Carrier screening can inform family planning, as it can be used to help work out the risk of passing certain conditions on to future children. Parents who are either carriers of or diagnosed with a specific genetic condition can now access prenatal diagnostic testing, which is non-invasive. It can confirm whether the pregnancy will be affected by the condition. Deciding whether to have a genetic test can be difficult. It is important you have all the information you need to make an informed decision. The benefits and disadvantages of the test should be discussed with genetic counsellors, doctors, and family members. Where genetic testing results in a diagnosis, it can help provide a person with more certainty about their future. It can also help guide personalised treatment plans and family planning options. In some instances, the results of the test may be unclear, and a definitive diagnosis cannot be made. Even where there is a diagnosis, it may be difficult to predict the severity of a condition. It may also be difficult to deal with the outcome of test results. For instance, if there is currently no treatment available for a condition. Finally, some conditions are so rare there isn't a name for them yet. These are known as syndromes without a name, SWAN in short. Further information can be found by visiting the Genetic Alliance website. Sometimes, patients who take a test are requested to take part in health research. For example, by looking at several people with the same undiagnosed symptoms, researchers can find new genetic causes for previously undiagnosed diseases. Analysis of the genetic data provided by research participants have also led to the development of more effective tests and treatment for many diseases. If you consent to taking part in research, your data will be kept private and your personal details will not be shared with the researchers. However, if the research provides new information about your health, such as a new diagnosis, it will be possible for the NHS to feed this information back to you. The NHS operates a strict process to ensure that samples and data they collect meet ethical standards and are stored securely. If you agree to take part in any research, you will be told whether the research is likely to have any clinical benefits for you, and you will have the opportunity to ask any questions. To learn more about what is genetics and how it can affect our health, watch the other videos by our GRACE project.
If you enjoyed this clip, feel free to follow the links on screen for more interesting articles and free courses from the Open University.